Hi, I'm Dr. Jason Gray, and here in this video we're going to review the general procedures for performing a lower back treatment known as Cox Flexion-Distraction technique, which is one of the unique treatments that we perform in our office when treating both acute and chronic low back pain, as well as with treating sciatica pain. Now, before we begin, I should point out that this video is really meant to be an adjunct to complement some of the things we talk about in our lower back pain report, which is written for lower back pain patients and serves as a guide to understanding some of the most common causes of lower back pain. Now, this report is available as a free download on our website, and I will also include a link in the video description below. So if you are struggling with low back pain, this would be a good resource to help you understand some of the more common causes of lower back pain, as well as some of the unique treatment approaches that we take in our office. Now, in that report, we do of course talk a lot about flexion distraction treatment, but words and pictures can really only say so much. So here in this video, we're going to review and demonstrate the treatment procedure itself, so you can easily see what it looks like and exactly how it's performed. So let's take a closer look. Now, we talk about some of the key concepts in much greater detail in the lower back pain report that I just mentioned. But just to reiterate here, and so we can understand the importance of flexion distraction treatment, realize that when dealing with any type of low back pain, really one of the most critical goals is to get the injured or painful joint of the lower back moving properly again. Remember, muscle and joint movement can be a powerful way to reduce swelling and inflammation at the site of injury, to control pain, and to guide tissue healing. Now think of a basic ankle sprain just as a simplified example here. In this situation, you wouldn't just ignore the pain and go for a run. That would be crazy, and it would just lead to more pain and injury. Now this is clear and obvious to everyone. But on the other hand, we also wouldn't want to just put the foot up for a week or two and rest the injured area. Sure, the ankle might not hurt too much when it's resting, but then when you go to stand on and use that foot again, it's not going to go very well. If the injured ankle doesn't move, it's going to suffer and get tighter and stiffer and more swollen, and the injured ligaments just aren't going to heal properly. So as you can see, getting injured tissue and painful tissue moving again is critical. Now that's not to say we just ignore the symptoms and move haphazardly. We of course need to move the right way. So with our simple ankle example here, we might prescribe range of motion exercises like ankle crosses, tees, or circles. Here we're using controlled, non-weight-bearing, low-force motions to desensitize the tissue and control healing. Then, as the injury starts to heal, we can progress the exercises to more advanced weight-bearing types of things to rehabilitate the injury. As I said, these principles apply across the body, including with lower back pain and injury. But when trying to apply these principles with lower back pain, there's a bit of a catch, because we really don't have a lower back in the same way that we have an ankle or a knee or a hip. These regions are single joint systems, so creating focused movement at these areas is easier. If we want to move the ankle, we just simply move the foot. But the spine is different. The spine is actually composed of a series of joints that connect to form a movable column. And when the lower back becomes injured, we wouldn't expect all the joints to be injured. We would expect the problem to be isolated to an individual area or a specific spinal joint segment. Now, just as I said, it's important to get the injured area moving again as soon as possible to control pain and healing. But the challenge with the spine is, one, how do we direct movement specifically at the affected segment? And two, how do we do this in a way that we can control the intensity of the motion so it does not exacerbate or further deteriorate the condition? And I would argue that with many approaches to back pain, this is very difficult, and it really doesn't happen with many traditional types of treatment. For example, think about how this applies to traditional stretches and exercises that are commonly prescribed for back pain. Consider stretches like a prone extension stretch or a spinal twist, or even a knee to chest stretch. And let's ask ourselves, with these stretches and with these movements and positions, which joints are actually moving? And the answer is we really don't know. In fact, in a lot of cases, there will be muscle tension and spasm around an injured joint. So what we often see with these stretches is not controlled movement at the injured area, but compensatory motion at the other spinal joints. And again, to be clear, I am not saying that stretching or exercises are bad or shouldn't be done. I actually believe that home exercises are essential, and developing a personalized home movement routine is something that we try to do with every single back pain patient. I just think that there are better exercises than the ones that are usually or typically prescribed or that show up on the top of a Google or a YouTube search looking for back pain relief. Now, what about in-office treatments and traditional manual therapy? Well, here I would suggest that there are some limitations as well. For example, some clinics will use expensive and sophisticated decompression tables or machines to stretch and decompress the spine. But these tables essentially work by tractioning one end of the spine away from the other. And therefore, they're really unable to create motion at an isolated joint segment. So what we see here is really the exact same limitation that we saw with traditional stretching exercises. And finally, some may suggest that traditional joint adjustments or chiropractic manipulation is better to get more specific joints moving again. But there are some studies to suggest that the specificity of spinal manipulation may not actually be, well, quite as specific as some may have you believe. Furthermore, if we go back to our sprained ankle example, it's not just getting the motion at the right area that matters, but also the intensity of that movement and the force associated with that movement. And oftentimes with an acute or sensitive lower back, spinal adjustments may simply be too aggressive and they may flare up the condition in some patients. So as you can see, there are several limitations and shortcomings of some of the most common treatments for back pain. And solving these problems is really where Cox Flexion-Distraction treatment comes in. So Cox Flexion-Distraction is performed using a specialized table that gently pulls and stretches the spine. So how it works is with the patient laying face down, the table can be unlocked, and then the bottom part of the table where the patient's legs are aligned is allowed to be moved up and down. And because of the connection between the legs into the hips, into the pelvis, into the spine, what we see is that motion of the legs will also translate into creating a gentle pulling or flexion motion of the spine itself. Now, this part is very similar to other traditional decompression tables, as we talked about earlier. But one of the things that makes flexion-distraction treatment so unique is that as I'm creating motion of the table and thus motion of the spine, I'm able to use a hand contact on the patient's back to go through each bone and each spinal joint in the spine in order to help create motion at that specific level. So for example, starting with a hand contact at the lowest joint where the spine connects into the sacrum and the pelvis itself, I can create a traction motion with my contact going upwards, and then I can work to gently stretch and pull the spine. But because of the contact of my hand on the spine itself, I'm able to create a separation or stretching motion of one joint or one bone on the other. And again, that's how the specificity of this treatment really works. Now, what we would typically do is go through each joint in the spine. And as I'm going through these motions, I am feeling for the motion to assess the segment as I'm doing that. And then as I find areas that are restricted and tight and lack the normal movement that they should have, I'm able to spend a little bit more time at that segment in order to try to release and mobilize and restore motion. So a typical treatment session might be to perform 5 to 8 of these kind of stretching or decompression motions. And we might, take a total of about 30 or 40 seconds. And then I would repeat that process through the various joints of the spine, and I might go through that several times per treatment session. Now, the other really big advantage that this type of treatment has is it has the ability not only to go up and down into this flexion extension motion, but we can also create lateral flexion motions of the spine as well. So again, this is performed similar to the flexion distraction component, but as I'm going through these motions, I'm also able to assess for side to side lateral motion and the circumduction motion of the joint itself. And by doing this, we're really allowing to not only clear flexion extension, but also lateral flexion and these circumduction motions of the spine in order to try to restore full mobility to each spinal section in the lumbar spine.